Hello, my name is Kelly Rupert, and this is a presentation on Pervasive Developmental Disorder Not Otherwise Specified, or PDD-NOS. What is PDD-NOS? This is a very recent diagnosis within the past 15 years, and it was developed because it has been found that some individuals do not meet the criteria for other autism spectrum disorders such as autism, Rett's disorder, child disintegrative disorder, and Asperger's disorder. PDD-NOS is for individuals that have some characteristics of autism and/or their behaviors are more mild, according to the Diagnostic and Statistical Manual of Mental Disorders, also known as DSM. These characteristics that are observed are social impairments and stereotyped behaviors. The DSM provides no direct list of characteristics for PDD-NOS, but it serves more as a guide. It can be very challenging to distinguish between autism and PDD-NOS. 0 to 3, a Center for Infants, Toddlers, and Families, has created a classification system as well and added multi-system developmental disorder, which is sometimes used instead of PDD-NOS. Causes are not exactly known at this time, but it is a neurological disorder. There is a possibility and hope of being able to determine causes in the future with the help of genetic testing and other developments in technology. Characteristics of PDD-NOS are typically not noticed, or there aren't enough signs present until a child is 3 years old, and then enough is observed to raise a concern for the parent. There are many common characteristics, but a child rarely shows them all at once. Also, the behaviors can be very different for each child. They may range from mild to severe, affecting more or less aspects of life. For example, some individuals may only exhibit behaviors at school or in the community with others, while some may exhibit behaviors in all aspects of life. The general characteristics and behaviors of PDD-NOS are explained here. Intellectual abilities of these individuals is widely varied. The social and linguistic abilities are affected, with delays in development of areas such as language use and understanding, interaction, play, and adaptability to change. Also, specific behavior patterns or repetitive movements may be observed. These individuals may also have limited interests or like only certain activities or topics. Even though behaviors are typically not observed enough to be diagnosed until age 3, there are things that may be seen earlier than early childhood. As early as infancy, the child may not show reaction to voice or may avoid eye contact. These individuals typically show less facial expression and they may be less reactive to affection. It's actually been noticed that parents think their child may have a hearing problem or may even be deaf because of the lack of responsiveness that these babies may exhibit. During early and middle childhood, these children also exhibit certain behaviors related to social development. They do not usually use or understand gestures. It may be challenging to interpret others' humor and emotions. They usually do not show subtle emotions, they are only expressed in more extreme ways. They typically do not use facial expressions. They most likely will not participate in play that involves imitation. As mentioned before, language development is also affected for those with PDD-NOS. As babies, they do not babble, or they may babble some during infancy and then it stops. Speech development is delayed. The speech often develops as echolalia. There may be a lot of repetition of phrase from others, or because they're copying what others are saying, their responses may come out phrased in an incorrect order. Pronunciation may also be affected because they do a lot of echoing what others say. They may make statements in the form of questions, meaning the intonation is different. It may often seem more of like a chant or sing-song kind of talking, and words may be elongated. Some of these speech impairments will fade with age, though. When diagnosing PDD-NOS, it is very important that a professional with a strong understanding of developmental disorders is used. Because there is no specific assessment available, a variety of assessments are used. A medical examination is done. There are interviews with family and other people involved in the child's life. Behavior rating scales are done, and direct behavioral observations are completed. The diagnosis is based on many different criteria as explained above, and it is also done by eliminating the other pervasive developmental disorders within the autism spectrum. Treatment should begin as early as possible. It is very important that treatment is individualized to the specific strengths and needs of the child after evaluations and assessments are done. Treatment for PDD-NOS is very similar to that of autism. A variety of simultaneous treatments are used to support positive and social communication behaviors. Some of these things include behavior modification, structured educational approaches, medication, speech therapy, occupational therapy, and counseling. Also, the treatment is done to support an end of negative behaviors. The negative behaviors typically occur because a child is struggling to communicate feelings such as frustration, confusion, and fear. Also, it is very important to have clear and consistent rules and expectations with these children. As mentioned, structure and clear communication is very important to support those with PDD-NOS or any form of autism. Here are the references that were used for this presentation.